Hey everyone, Dr. Aaron Moreland from Vallejo Health and Wellness Center here in Eden Prairie. I'm with Dr. Ryan Christensen from Vallejo as well. And today what I want to talk to you about is a common shoulder issue that I see with a lot of the patients that come in. They come in and the common complaint that I'll see is that it hurts right here, doc. That if I rub right here, there's a big knot right here. I maybe have my spouse or a loved one rubbing on it and it feels good, but it just keeps coming back. This is a very common thing that I'll see. Another thing that they might complain of is that they get numbness in their hands. And so what I want to talk to you about today is a very common solution to this problem, and it's actually working on a muscle that most people don't know about, and most people wouldn't think that this is where the problem is, because if it hurts back here, that must be where the problem is what a lot of people think, when in actuality it's a muscle called the subscapularis, or the abbreviation, the subscap is what we'll call it, and it's actually inside the shoulder at the front of the shoulder, and it's actually what usually causes this problem. And so what I want to do is show you some ways that you can figure out if you have this problem, and then I'll show you a quick fix to the problem. So I'm going to show looking at posture first, because this is really the first thing that you can do. You can look in your mirror and you can see if you have this problem. So Dr. Ryan, I'm going to have you stand up, and what I want to do is just show what we would see if you look in the mirror with someone with this problem. So they're tight right here, they're constantly having to reach over with their opposite hand and rub that, and typically what I'll see with that is that rounded shoulder. So if you turn to the side here, Dr. Ryan, we should see this line up straight with the ear, and that's what we see. But with that rounded shoulder, we'll see hit kind of the middle of the ear, even the front of the ear. So if you see that, or if people are telling you that you have that, then that could be a sign that the subscap is tight. Another thing that I'll see, and when I'm looking from the front, is that typically when someone stands here, you should just see their hands hanging to the side. But with someone that has a tight subscapularis, the arm will be rolled in. The shoulder may not even be rolled in. You look from the side, it looks good, but that arm can be rolled in. So you see it across the thigh, and you can see the back of the hand rather than seeing the hands just hanging to the side like that. Those are classic signs of a tight subscapularis. So what I'm going to do is I'm going to show you something that potentially you may be able to do on your own, but a lot of times you're going to need someone that really knows what they're doing, like a health practitioner like myself, to fix this problem. And so what I'm going to do is I'm going to show you how to find it, and then what I'm going to do to fix it. So I'm going to have you lie on your back, Dr. Ryan. And so the subscapularis, like I said, it's in the front. And the issue that we have, just so you'll see it right away, is that I'm going to have to go through his armpit to get to it, okay? But the first thing I want to do is just look at his range of motion, comparing side to side. So with Dr. Ryan, he's pretty flexible. He's got good range of motion here. I'm going to check the other side as well. Typically, I'd go to the other side. But I'm looking to see is how far can that arm go back. Typically, with someone with a tight subscapularis, you'll see them not be able to go as far. They may start complaining like, oh, I got like kind of a pinchy feel kind of in the back of that shoulder. That's a sign that that subscapularis isn't relaxing like it should. It might even be a sign of some impingement. So one of the things as a practitioner is I got to figure out what it is. But in Dr. Ryan's case, let's just say it's a tight subscapularis. So what I'm going to do is I'm going to go into the armpit, not real comfortable, not a real enjoyable place to have worked on. Typically, people will say it's kind of a hurts so good type of a pain. So what I'm looking for is I've got my thumb, I'm pushing pretty far into the subscapularis, and what I'm looking for is if there's any tightness. I'll never forget a patient that I had, a 17-year-old athlete, pole vaulter. He couldn't pole vault because his shoulders were constantly hurting. He'd been to orthopedic doctors, physical therapists, and no one had actually got into his arm like I was doing. I got into that subscapularis, and it literally started to make him to cry. And so I think he thought, okay, this is never going to get better because this hurts so much. But after about 6 to 7 treatments, he had it on both shoulders. One of his shoulders was 90% better, the other shoulder 100% better, and he was back to pole vaulting. So what I'm doing is I'm looking for trigger points in that shoulder. I'm doing some trigger point work where I'm pushing on that muscle, that knot in there, 5 to 7 seconds at most, sometimes even just 3 seconds because it's kind of tender to be on. And so what I'm doing is just hitting, he's got about 3 or 4 of them in here in the armpit. I'm releasing that muscle, And then what I'll do is to reset, there's a nerve inside the muscle. To reset that nerve, I'll actually do a stretch called PNF stretching, proprioceptive neuromuscular facilitation. You don't need to remember that, but that's what PNF is. So it's really working on the nerve that's inside the muscle to reset that muscle. So what I'll do is I'll stretch it out, and then what I want you to do, Dr. Ryan, is take a deep breath in, hold that breath, then go ahead and push up into my hand, and then let that breath out and relax. And so I'll do this about 2-3 times. So go ahead, yep, and then push. Let that breath out and relax. And that just sets that, retrains that nerve. That's what that PNF stretching is doing. It's hard to say how long it's going to, like how many sessions that will take, how many different treatments, but typically I'll see, depending how long it's been there, I may see 2, 3, sometimes I'll even see, like what I mentioned with that pole vaulter, 6 to 7 treatments, but typically I won't see it ever more than 8 times that I'll need to see a patient for this type of condition, and huge results, huge benefits to that, because then the people don't have that feeling that they're constantly reaching over and having to rub their shoulder. So hopefully this is helpful, understanding what it is that you can do to figure out what's causing it. In the next video, what I'm going to do is I'm going to show you how you can do some specific exercises that you can help your body to not have that position anymore, or just to prevent it in the first place. So I'll show you some things that you can do throughout the day that would be helpful. Again, this is Dr. Aaron Moreland at Vallejo Health and Wellness Center. If you're liking our videos, please subscribe to our YouTube channel. We're making these videos because we want people to be as healthy as they possibly can be. So again, hopefully you're having a great day, and we'll see you in the next video. God bless.